worst part became when the Ministry of Women's Affairs had their women's conference. Everyone had to be addressed as a lady, and I became a lady for 3 days. So I'm comfortable in different environments, ladies and gentlemen. We have the supplier in the house. Is here, Mr. Wolfgang Lech, coming from Germany. Please come through and make your presentation. Let's put our hands together and welcome him. Thank you.
Thank you very much for the introduction. I wanted to tell you now something technical about the instrument. Mr. Shandivana has done it in the meantime, so I've got a short speech. When I arrived here this morning, I was asked by some of you, why does Germany now do this to Zimbabwe, do this donation to Zimbabwe? What is the reason? And I really have a confession to make. My first love, many years ago, was a Zimbabwean girl. And I still have got a soft spot for Zimbabwe, and that's why the instrument came this way. So we have been with DLS a long-term partner, as Mr. Shandivana said, 14 years. I myself be with him for the last 7 years. We've gone through bad times and good times. We had very many heavy discussions about this project. We had some disagreements, but in the end we came together and pulled it off. So I'm very pleased that this day is happening now finally. And that we could help doing it. So the Human team, which has done the training in the last week here, and all the Human team in Germany, looking forward to do more things like that. And I hope the instrument and the reagents for the instrument will have, in the end, a positive effect in the healthcare service in Zimbabwe, which I'm sure will happen. I also know very much, because it's in the African gene, you need many more instruments of those. I'm sure that is the thing which we have to work on next, to see how we can spread and can do more of these things. Yeah, so this is actually all what I've got to say. We are behind you, and I hope it will be a success all over. Thank you.
It will be very interesting to know where you met this Zimbabwean girl first. We'll have a side discussion. Very nice. So here we function with totems, and you cannot go away without one if you had your first love with the Zimbabwean girl. So we shall be giving you one, or we can find one for you immediately, so that you carry it with you. Let's see which one would be. I think Mazibakupa will do. And I'll explain to you what that means. All right, thank you so much for the presentation. It is my pleasure now at this moment in time to call upon National AIDS Council CEO Dr. T. Agure to come through and address us. Thank you.
Once again, I would like to recognize the ISO certified or ISO satisfied Director of Ceremonies and our guest of honor, the Minister of Health and Child Care. On behalf of National AIDS Council Board, Management and staff, it's an honor for me to have been asked to make these few remarks. Just to advise you that our relationship with Diagnostic Laboratory Services and indeed Human, who are the manufacturers of these chemistry analyzers, began several years ago, when National AIDS Council procured 12 chemistry analyzers, among other machines that we procured for the national response to HIV. The chemistry analyzers were some of the first equipment that we purchased when Zimbabwe entered the multi-currency, which, as you are aware, managed to improve the economy. During that time, our national antiretroviral therapy program was undergoing rapid expansion on the back of improved AIDS levy inflows and also external support from the Global Fund, the United States government, and other donors. We realized that as more and more people were getting initiated on antiretroviral therapy, there was an urgent need to invest in relevant equipment to monitor those antiretroviral therapy clients for drug toxicity and also for vital organ functions. I think Mr. Chandwana highlighted that chemistry analyzers also do liver function tests, kidney function tests, to name but a few tests. As you are aware, the National AIDS Council is responsible for managing the National AIDS Trust Fund, and we have continued to invest at least 50% of the AIDS levy towards antiretroviral therapy, which includes purchasing of antiretroviral medicines, opportunistic infection medicines, laboratory equipment and reagents, HIV test kits, and also antiretroviral therapy outreach at sub-district level. And you may also be aware that our minister has designated us to coordinate cancer interventions as well. And we have already invested quite a bit of funding for procurement of cancer screening equipment, anti-cancer medicines, and also training. With regards the machines that we are receiving today and the old ones, I want to assure you that the National AIDS Council will continue to procure the relevant reagents as part of our mandate. We are glad today that our partners, Human and Diagnostic Services, seeing that our chemistry analyzers have become older and needing more regular repairs in view of the workload involved at provincial level and also district level, they decided to donate this new equipment, the advanced Humastar 200. The new machines will enable a smooth transition from the old system while providing for handling of complex tests and increased workload. So we are really grateful that in addition to free installation of the equipment, there are also training staff from those 12 sites for free. The transition from old to new system highlights the pace at which technology is fast changing in the response to HIV. In view of this, we are also in discussion with several suppliers about the possibility of maybe renting as opposed to outright purchasing of equipment. Such a scenario will allow for continued transfer of technology and also provision of backup services without having to suffer total losses when you are migrating from one system to another. And I think it has already been highlighted that the donation is worth more than 240,000 euros. So we are really very grateful, because we all know that we are already having foreign currency challenges. So once again, we are very excited to be part of this occasion, and we will continue to support the national response going forward. Thank you.
I would want to welcome everyone to this important occasion, and I'm just going to talk briefly about why we are here and with the Humastar 200 handover ceremony to the Minister of Health. Historically, we had instruments in the market which have been there for the past 7 years with National AIDS Council. So, like in another environment, we decided that we wanted to upgrade, like you heard Mr. Manyika is trying to upgrade from the old software to new software. So we made exactly the same decision that the instruments that we were bought by National AIDS Council needed an upgrade in terms of the software, in terms of functionality, so that it can be able to serve the patients in a much better way. So the purpose of the shift obviously is new technology with low costs and running and maintenance costs, and also improvement in terms of accuracy, precision, and obviously because we have got patients who are on antiretroviral therapy, the emphasis is on short turnaround in terms of results, so that when they go to the hospitals, they don't have to wait for their results. They get their results instantly. Hence, we had to move to a faster equipment which will produce results faster. The UMaster 200, producing 200 test results per hour. It's a 2-time award winner. The IF award, which was won, I think, in 2014. It's a big beast because it's also won again in 2015. The best design awarded by the German Council, which obviously is an independent board, and when you get an instrument winning concurrently one award after the other, it says a lot about the instrument. And it's a CE marked equipment. So the UMaster 200 is the first choice for laboratory processing up to 650 nanometers. This is a bit of technical jargon, but for those who are in the medical field and they've done technical work or are scientists, they will understand this. But its ease of use, as opposed to other instruments, is also one important marker, whereby you can be able to load your samples continuously, and also if you've got an emergent sample coming in for someone who's in ICU or in theater, even if it's running already, you are able to load that sample and get a result quicker than the others which are already running. We call that a start function. So it will suit for small to medium sized laboratories in terms of our health sizing of our laboratories. For those who are in the private sector, we have got small to medium sized laboratory. This is the right sizing of the instrument in terms of its output. For those with big laboratories like our Pareniatua or the private sector, we have got big analyzers. This can be used as a backup analyzer again for big instrument. It has an extraordinary low water consumption of 1 liter per hour, unlike other instruments which are guzzlers. So you might need a lot of water, but with this one you don't need a lot of water to use. That grants autonomy from water supply units. The cuvettes are long lasting and reusable, so you don't have so many accessories that you have to replace now and again, emphasizing the low cost that we badly need as a country in terms of not wasting. So there is not much that you have to buy as consumables to keep the machine running. The only consumable which is definite is the fuel, like in your car. So the fuel for this machine are called reagents for you to be able to produce the test. Maintenance support is simple, can be done through communication platform feasible on telephone, email, or Team Viewer. There's a new platform called Team Viewer. Our sales engineers here can do Team Viewer with you if you're in Bulawayo or in Mtale. We also have got a hotline here which is able to support everyone who has our equipment. Our technical service center will do that 24/7, 365 days in a year. So the uniqueness again on the instrument that is able to detect if there is the needle itself when it's picking the samples and the reagents, if it will not crash, because most of the instruments, the needles, they crash. So they did what is called reverse engineering to ensure that when the needle hits or is hindered, it doesn't crash. So once someone comes and programs the tests, they can go away and do other tasks in the laboratory, and they come back maybe an hour or 2 hours later just to collect the results. So the test menu, we have got about 50 tests that can be able to do there. These tests, you are testing all the organs of the body, your kidney function, your renal function, your liver. You've got the modern tests like your cystatin C, your homocysteine, the C-reactive protein, your microalbumin for early renal failure detection. So these are all crucial tests for diagnosis of patients who may be receiving heart treatment. So the brief history, it's been a long journey. We started in 2015 between ourselves, Diagnostic Laboratory Suppliers, and Human, and the other most important, obviously, stakeholder, National AIDS Council, and Ministry of Health and Child Care. The value of the equipment is around 240,000 euro, including all the training which was held, and we are going to be installing this instrument at the 12 sites of which were given by National AIDS Council and the Ministry of Health. So this week we trained 12 sites. We were training trainers, meaning the people who were trained here, when they go back, they're able to train their peers. But as we do the installations again, per site, we are also going to be there for 2 days to also train others users who were not able to participate in the training. And the ones who were trained, I'm glad to tell the Honorable Minister that the scientists who were trained, we did give them the certificate of competence, meaning they succeeded in the training. And I was informed that they will also be getting CBD points, as these are medical people, when we gave them the certificate of competence, thanks to the Director of Laboratories, Mr. Ngwani. In conclusion, we will continue to support the Ministry of Health. I think historically this is not our first occasion to donate. It's in our DNA. In 2007, we did donation to central hospitals for viral load equipment. So we are only maintaining a culture which our Honorable Minister has been leading by example. He did launch the PPP, Public-Private Partnership. So in that spirit, we are guided by our Minister to have that as part of our planning. We only ask our Honorable Minister that we know there are challenges in the country. You are very close to the Reserve Bank manager. And in terms of allocations, we kindly ask that the Ministry of Health, for its requirements, be it its drugs or the essential reagents for patients who are on heart, be prioritized. We will also maintain all the essential spare parts here at our office and our warehouse so that we are able to service the equipment in time, ensuring that our patients in various hospitals, they get the quality of that they need. I thank you, ladies and gentlemen, for listening.
Thank you very much, Mr. Chandiwane, for your presentation. I'm very comfortable with the medical jargon that you were talking about. Just for your information, I was invited by the Doctors Forum to go to Victoria Falls, and for 3 days, everyone had to be addressed as a doctor, and I became a doctor for 3 days. That was very, very comfortable. Dr. Manyika, very well. And then the Institute of Engineers invited me to go with them as well, and for 3 days, I was Engineer Manyika right through, and I felt so good. But
represented by our Honorable Minister. So, Honorable Minister,
Yeah.
we are the chemistry analyzer machines which have been donated for use by the Ministry of Health and Child Care. These various institutions.
Ndapiwa kuti ndicheke ribbon. Kana ndacheka moti
yeah, Pacheco. Yeah. That's the whole point. Now the unveiling for us all to see.
Media, you can come around. How many tests can you do? Can I give them space?
650 tests an hour.
Huh?
650 tests.
An hour.
Yes.
Yeah, this is phenomenal. I tell you. So Mattia, he says this is like our
It only uses a liter per hour, so it means in a day you only use at most 8 liters. So it's not a guzzler.
but it's user friendly.
It is ease of use. I think they say idiot proof, that's the word they use.
Yeah.
Ease of use.
Yeah.
Tier rating, they call it ease of use. ABC.
Yeah.
Yeah, it's as easy as ABC. It has an on-board coding, so it has a refrigerator. If your agent will be here in this compartment, and this is a cooled place. So you actually, the whole place will be cooled. So your reagents, which are supposed to be maintained at 2 to 8, even if they are working, they are still at 2 to 8.
Oh, good.
So there is no variation in terms of getting results. So you've got consider. He is the technical guy here.
Yeah. You want to say more?
And it's already demonstrating this kind of attachment to
Demonstrate. Oh, no, I think it's fine. Okay, thank you.
Thank you.
They want to take a
The
picture.
picture, Wolfgang, come and get the opportunity for.
Maybe you can come here, guys.
Okay, here.
That's the picture. Soon after the minister, Wolfgang, you take a picture with me, and then we don't lose that opportunity, right?
Thank you.
Dr. Magure, if you can go through as well. Thank you so much.
Yeah,
Another handshake, so you do the crisscross.
okay, well done, Christmas. Well done, well done.
Aha, Dr. Mugurungi, Mr. AIDS Man.
Dr. AIDS.
There is the AIDS Man. Interesting. Wonderful.
Thank you.
Thank you so much. All right.
Pleased that you are here. Dr. Makure, National AIDS Council, Dr. Mgurungi, vanozikanwa kuti ndochiremba weAIDS. Let me recognize Mr. Wolfgang. Thank you very much. He's just come from Ethiopia, and from the flight he came straight. Time to rest, but we gave him some food, and he's now a bit more alert. Chandiwana, let me recognize you. Together with the person who is our Director of Laboratory Services in the Ministry, Mr. Mangwanya, but also the various other partners that are here. I saw somebody from Lancet, Dr. Muronda, but also all the other very important people that are here, including our media. Media, but this is a very important function. To a lot of people, when you see a function like this, you think, well, it's just one of those. It's not. You see, for any health system to succeed, there are 5 main things that you must always look at. And the first one is always human resources for health. Machiremba, Manes, my lab scientists, and others. That's number 1. Number 2, it's always drugs and medicines. If you do not have enough drugs in your institutions, even the patients perceive it as a poor service. So artists could die in our 100 days. Kutikana mainda ku casualty, vanoramba vachipiwa prescriptions to go and buy outside. So we want to improve that, Mr. Manyika. And we are pleased that the Reserve Bank Governor has said, look, because of the health levy fund, which is now about 22 million, health levy fund, where I must urge you again here, Varipan, How many of you have got mobile telephones? Yeah, I think everybody. So please use them. Use them, use them. Now use them. Because each time you phone and it's worth $1 of your phoning, 5 cents comes to the Minister of Health. So please use them. So that we get that 5 cents. That is the 5 cents, that has now come to 22 million. And this is what we are also using for drugs and medicines. And that is why we're asking the Reserve Bank Governor that we have got the bond notes, but we want the foreign currency. So the third thing you want is infrastructure and equipment. So it means your hospitals, your clinics, and you, as you know, we've got in this country 6 central hospitals, 3 here in Harare, 3 in Bulawayo. We've got 8 provincial hospitals. We've got 63 district hospitals, 43 mission hospitals. We've got 23 what we call general hospitals like Kadoma, Rusape, Kwekwe. Then after those hospitals, we also have 1,200 health centers. So it's a big, big infrastructure within the health delivery system. So you need that. But infrastructure also includes equipment. You must have equipment in your institutions. And that is why this HOMSTA is so important for us. It's one of the pillars of a health system. That when you go to a hospital and you've got a broken leg and they do an x-ray, they may decide when they see you, since you've come here, we are not seeing you well. They do an HIV test on you. Then they find perhaps you are HIV positive. Then they say no, because in this country now, we've got 1.1 million people on ARVs out of a possible 1.4. So we're saying of those 1.1 who are positive, they must go on to, they are on treatment already, but we must monitor them and see how well they are doing. And see if those drugs are not causing any damage to them. Are they not damaging their kidneys, their liver? That's why now you have a chemistry analyzer. Take blood, and analyze that. So this is important to us. So that's the fourth thing that you need to have, infrastructure. The fifth one is transport and communication. Your ambulances, your service vehicles, and of course, the communication systems, the ICT. So I'm very pleased and honored that you have invited me to receive this very important HOMSTA 200 machines, chemistry analyzers, that have come from a very reputable German company. And I was asking Mr. Wolfgang there that, are they using this in Germany? Because sometimes you are given what is not being used by those countries. So I asked him, and I asked like I'm not asking. And he was outright that, no, we use this. They are not only being used in Germany, the Russians have bought them, the British, all over the world. In fact, those ones won prizes in Germany. So it means they're being used in Germany. So we're pleased with that. And this is a top-notch, top-of-the-edge type of equipment. So we're not getting second-hand, we're not getting something that I think is a backdoor. This is top range, and we're very pleased with this. And they're going to replace the 12 that were there before with these new ones. And they are all in there. I saw them, and I'm very, very pleased. One will go to Josiah Magama Barracks and Hospital. The second one will go to Chinoi Hospital. The third one will go to Mutoko Hospital. The fourth one will go to Manyame Air Base. The fifth one will go to Marondera Hospital, then Ndanga, Bindura, Three Field Hospital, Thorngrove Hospital. I quite like Thorngrove too, because Thorngrove is an infectious diseases hospital in Bulawayo. And I think you have done well to identify this. And then, of course, Gwanda Hospital, St. Luke's Hospital, and One Maid Hospital. So this is good selection because it's countrywide. And I think you should maintain being able to decentralize all our services. And I'm aware that the lab scientists, Mr. Mangwanya, your lab scientists, you have got an establishment countrywide of about 359. And these are important people for us. Those are the people who will be using this. Those are the people who should acquaint themselves and use them well so that they've got longevity that lasts for some time. So, when you receive such things, you don't want to say too much because most of the time they are really very happy inside. And I want you to share with me that this is a very good. It's a donation. We really are not paying anything. It's a donation. But it means that the government of Zimbabwe should complement this. This is what we call public-private sector partnership. The government should complement this. When you get a budget of 409 million US dollars for the Ministry of Health, we want that, as you all know, our bid was $1.1 billion. Now we were then allocated 409. So there is a big gap of what we need. And so when you see your health system screeching and not coping with medicines, no medicines, then the problem, the challenge is always that one, that we need sufficient resources. And sufficient resources from Treasury, they must go to 15% of the national budget. And I think this is what they are aiming to do. So with those few words, let me accept this, and again, thank you very much. Thank you, Mr. Chandiwana. This is a very nice outfit that you have here, and you have got a good staff, you're well trained, seemingly quite disciplined. We're pleased with that. Continue the good work. And again, with those few words, congratulations and thank you very much.
Thank you very much, Honourable Minister, for gracing the occasion, being our guest of honour, finding time in your busy schedule to be with us this afternoon. We have a small token of appreciation. I'm not sure which side it is coming through. If someone has it, please bring it through. But you don't bring the Honourable Ministers present and my present. You might mind you give me at the back and you bring the ministers in the front here. Okay. Please receive this small token of appreciation. Just to say thank you. It's a small analyzer that's in there. Wherever you go, you can do the test. Thank you so much. Laboratory Services is the Director, or Director of Laboratory Services, Minister of Health and Child Care, Mr. D. Mangwanya, coming through to give the vote of thanks. Thank you.
Okay, thank you. As you certified, Mr. Chairman. I would like to recognize the Honorable Minister, Dr. David Parrington, Mr. Wolfgang Rich from Germany, in the high table. Oh, Protocol Observed. Thank you. I would like to thank first our Minister for having this time to come to this important occasion. He has a very busy schedule. And we are pleased that at least today he managed to come to this occasion. Thank you, Honorable Minister. I would also like to thank his team from the ministry, Mr. Mjiri, the PA, and other Minister of Health staff present here, Dr. Mkurungi, who is my colleague. I would like to thank the National AIDS Council, Dr. Magure and his team. Dr. Magure Honorable Minister, he did a splendid job. He is the one who actually organized this deal with the man that they wanted these machines donated. They approached my office, we gave them the go ahead, no, it's okay, and the donation came through. And this really is a very, very, very big donation. Because the 12 machines we have received today will go to the 12 districts the minister has announced, which means those 12 districts with old machines, we are going to take those machines to other 12 districts. So we will now have at least 24 districts with machines doing liver function tests, kidney function tests, all other tests. So this is actually a huge improvement in our laboratory services. And with this, I think we will achieve our targets within the 100 days. It is that we'll be able to do most of the tests. I would also like to thank Human itself and his team. Sie sind sehr wirklich willkommen in Zimbabwe. Vielen Dank. Anyway. No. Human, actually, I was a student in Germany for many years. I did my practicals actually with Human in Wiesbaden. So really, Human produce quality machines, one of the best machines in the world. It's true. I thank you. I would like to thank also the other people who are here from the University of Zimbabwe College of Health Science. Dr. Maramba, thank you very much for gracing the occasion. At least you are seeing that what the minister is doing from the university side. Zimbabwe means your role for quality management system in the country. These are the new machines, so we need to put them into the new database. I'm glad you are here. The heads of departments from central hospitals who are here, from Chitunguiza Parenya to our hospital, I thank you for coming. The participants who are here, I think the minister has told you that at least look after the machines. We expect that you deliver, you maintain these good machines that have been handed over to you today. To the media, Janet Nyaga and team, thank you. I think these days we are busy working with you. We thank you very much, yes, for highlighting most of our occasions. I would also like to thank Dr. Muronda. Of course, he was here from Lancet Laboratories. It's a very huge private laboratory which also uses similar machines. So this actually gives us confidence that these machines we are using in government are also being used in the private sector. Finally, I would like to thank the staff here and everyone who is here today. I thank you very much.
Thank you very much, ladies and gentlemen. This brings us to the end of the event. Short of